Welcome back, everybody, to Leading Experts. I'm your host, Grayson Foster. Joining me on the show today are two of the top cosmetic and general dentists who just happen to be father and son, Dr. Marc Schwartz and Dr. Eli Schwartz. We've been talking about the latest advancements in smile design and the importance of comprehensive dental care, and we're going to get to that right now. Let's talk about how your oral health affects your overall health in general and certainly can affect your lifespan.
I think that up until the last couple years, people really didn't understand the impact that taking care of their mouth had on their health in general.
Right.
There's been a lot of studies coming out the last couple years showing that the health of the gums, are very correlated to the health of the heart.
Right.
Because there's a lot of bacteria in the mouth, and when people don't clean that out, it gets into the bloodstream. It can have an overall effect on your general health, especially your heart.
We just sort of take it for granted, don't we?
Yeah, well, people don't know, so they don't think about it. But
what about for people that are suffering with periodontal disease, have actually gotten to the point where they have that problem, and that can elevate your cholesterol and certainly your glucose levels, and that's very, very serious for diabetics. Do you deal a lot with that in your practice as well?
Well, we do.
Yeah.
You know, ophthalmologists can look in the eyes and see disease, and we can look in the mouth and see disease. People with healthy mouths are healthy people.
Right.
And people that don't take care of their mouth, it reflects in their overall care. So it's really important that the mouth is the key to the health of somebody's complete body.
Now, besides the beautiful cosmetic cases that you do in your practice, you see a lot of families as well. At what age are you supposed to be bringing your kids to see the dentist for the first time?
I think really what they tell you is that your kids should really be coming in when their teeth are in their mouth. Generally, people don't start bringing their kids in until about 3 or 4 years old.
Right.
But obviously, the earlier you bring them in, the better.
Right.
Okay? Not only for the child, but for the parent. Okay? A lot of it is instructing the parent on how to take care of the child's teeth, because really people don't know.
Exactly. What about expectant moms, too? That's a big issue, because I think most moms just kind of put themselves on the back burner. But when you're expecting a baby, it's critical to look after the health of your mouth, right?
Well, what happens is, as you know, people that are pregnant, their hormones change. And any problem that's in the mouth is exaggerated by that hormone change. So little inflammation becomes a lot of inflammation. And they used to say, oh, you lose a tooth with every child, which is an old wives' tale. Really, it's they just didn't take care. If you take care and maybe go more often for your maintenance and your cleanings, you'll have better care. And today, not only can people expect to keep their teeth a lifetime, but pregnant women don't have to lose teeth or have gum inflammation either.
Exactly. What other technologies are you using in your practice with your patients?
I mean, we have so many. We have the main thing that's come around in the last, say, 5-10 years, the digital x-rays. The x-rays come up on the screen instantaneously. There's almost no radiation. It helps with every part of dentistry. We have a laser that helps us detect cavities. So a lot of times before, the cavities would get larger and larger until you could actually see them in the mouth. But now the laser can help you get them when they're small to kind of prevent that. We have intraoral cameras in the office. So we can actually, as what we see, the patients don't ever actually see their teeth.
Right.
So when you're actually giving them the opportunity to see what their teeth look like in their mouth, then they don't have the same kind of worry that you're telling them something and they're not hurting. But when they can actually see it for themselves, it makes a huge difference for them.
You know, it's amazing that we show pictures of people's teeth. And they go, what's that? We say, well, that's your tooth. They go, that's my tooth?
Yeah.
I mean, it's really like they just don't believe it.
Yeah.
So we've started to let them hold the camera and look at their own teeth. And they're amazed when they see it immediately up on the TV. And they know when something needs to be changed. Or they see something and go, gee, that just looks ugly, like those black, silver, amalgam, mercury fillings.
Right.
There are better choices today.
Yeah, I know a number of people who have gone in and gotten rid of all their amalgam and replaced it with the nice white filling, and it made a difference to their health too. Something else I want to talk about, since we're talking about your new technology, is you have a brand new beautiful office, and we're going to put some pictures up while we're talking. So talk about your state-of-the-art facility that you just opened.
Well, the beautiful thing about it is after being in a location for almost 30 years. We were able, because of the opportunity that arose, to move into this new office, and Eli joined the practice, and it was like an incentive to do that. And now we have a state-of-the-art office that can provide state-of-the-art dentistry, which is why we call ourselves Advanced Dentistry of Plantation.
Right.
Because everybody wants something advanced.
Yes.
Because even fillings are cosmetic. Everything you do is cosmetic. It's not just the big cases. Sometimes people need one filling, one crown, one veneer, one implant.
Right.
It's all cosmetic and aesthetic, and certainly advanced.
I want to, just in case people are tuning into the show right now, I also want to make mention that in your family, you've had dentistry for over 100 years. That is amazing to me.
Yeah, well, I mean, it's amazing to you, but I've never really known anything but.
Yeah.
So, you know, my father, my grandfather, my great-grandfather, my father's uncle, I've never been around anything but dentistry. So to me, it's normal. To everybody else, they find it pretty amazing.
Yeah.
And I grew up having my father have an office in the house,
Right.
as many in the past did. And I would go downstairs and watch him work by himself, and to see how things have progressed from when my grandfather in 1909 was in NYU Dental School, and in fact wrote 7 dental textbooks. And the history has transformed through the years, and here we are today, and I couldn't be more proud to have the family tradition.
It's amazing. Did you have any of the equipment from either your grandfather or your great-grandfather?
We actually do. We actually do.
That would
Not only do we have the equipment, but I actually have my grandfather's yearbook.
Wow.
And with all of the illustrations, that since he was an artist before he went to dental school, that he did most of the illustrations in the book.
Well, being a dentist is being an artist, really.
Yeah.
You know, absolutely.
I mean, there's no reason to have dentistry done to make people healthy and look good at the same time. That's the plan, really.
On a more serious note, just before we go to a break, let's talk about oral cancer, because I know you screen your patients each and every time for oral cancer, and this is critical, isn't it?
It is critical.
Yeah.
And it's important that you do an oral cancer screening every time somebody comes in for a recall exam. And not only do you do a physical exam, but now we have the ability to do screening using various testing. You could talk about that.
Yeah, I mean, in the last year or so, they've come out with a lot of things, you know, to find things that you can't see with the naked eye.
Invisalign.
Yeah, Invisalign. I mean, we do that in our office, but really a lot of things that go on, okay, before they become cancerous, you can't really see them.
Right.
So with the testing techniques that we have, you can see them, but you can't see them with the naked eye. So those are a great adjunct to finding oral cancer.
Absolutely critical. All right, gentlemen, we're going to take a break. Stay with us. We'll be right back.